All right, brokers, welcome back to another wonderful education day brought to you by Health First. Today, we are going to be covering the 2024 Utah individual and family market, and here's what's on the agenda today. So, with me is Brandon Combs, the president and CEO of Health First, and today we are going to be talking together about changes to expect for 2024. We're going to talk a little bit about marketing opportunities and the marketing kits that we're putting together for you all. We're also going to talk about Health Sherpa and a little bit about why you should be using them as an enrollment platform, and then just some of the aspects of the information that we get by being your general agency or your upline through Health Sherpa, and how that benefits you as a broker in your day-to-day operations. We're also going to talk about Health First's proprietary broker portal, which we call Agent Intel, and just showcasing the cool features that are in there. We're also going to talk about our quoting software, which we call QuoteMeal. By the time we're done with this, you can actually go ahead and get signed up with Agent Intel and QuoteMeal, and you can actually start running quotes today for January 1 effective dates. So a little bit of a jump start there. And then we're also going to talk about eSign, which is our solution for those of you that need to start gathering consent forms and application attestation forms. If you don't already have a method, we did put together a solution, and we're going to share that with you today. Without further ado, let's go ahead and jump into changes for 2024, and I'm going to go ahead and hand it off to Brandon Combs.
Thanks, David. So we're going to jump right into changes for 2024 with marketplace changes. So the first one being, and it's not so much a change, this is an indefinite solution to the family glitch and the affordability test. This continues for 2024. There's a newer, lower threshold of 8.39%, which is actually down from 9.12% from 2023.
So, yeah, just wanted to jump in real quick. So, for those of you that weren't familiar with this, ultimately there's been a fundamental change to these rules where in the past, if group coverage was deemed affordable for the employee, but the family portion was unaffordable, they still couldn't go get a subsidy through the marketplace. They just had to sort of bite the bullet and pay the cost for their group plan. And so essentially what they've done is they've fixed this family glitch fix. And so now they say, okay, if you are a family and you are offered a group plan, there is potential now that it can be deemed unaffordable so that your family can go to the marketplace and get a subsidy. And it's based on this threshold, 8.39% of your income. And it's actually lower than what the percentage was last year. So ultimately, now when you run into families and they say, oh, we have a group policy, it used to be you would say, oh, you're offered a group plan, you're not going to qualify for this. Now it's, okay, you're a family, you're offered a group plan, you still may qualify for subsidized coverage to the marketplace, but we have to do this affordability test and see if the lowest cost plan available to the employee and the family, if it's under or over 8.39% of your income. And if it costs more than that, it's unaffordable and they can go get a subsidy.
Yeah, it's actually been a great change. We'll also go over, we're not really going to go over HSA limits, but they did increase like they do every year, along with the federal poverty line chart. Both of these are showcased in the 2024 placemat. So if you'd like to reference those, you can check them out on the placemat. I'd like to talk a little bit really quickly about standard plans versus custom plans. So CMS has a rule now where a carrier is only allowed to offer 4 plans per category. Now, a category is essentially a metal level. So bronze, silver, gold, or platinum. and that includes network. So if a carrier has three different networks or two different networks, and they if they offer a silver plan, that's actually three silver plans because it's in those three different networks. So there will be a reduction overall in the number of custom plans that carriers are able to offer. That number actually decreases down to two plans for 2025. So just keep in mind there will be some shakeup as well next year. Medicaid redetermination will continue through July 31st of 2024. We've got some new carriers entering the marketplace this year, Aetna and Imperial. There's some new rules around consent and attestation forms that I'm sure you're aware of. They went into effect back in June of this year. And so now brokers need to have a signed consent form for all of their clients, an application attestation form for every application that they do, and they need to keep these on hand for 10 years. And so we can help with that and make your life a whole lot easier. David will be going into that during the agent intel and quote meal portion of this. Short-term plans, we typically use Allstate for these, and so we'll go into new rules and laws around that that are coming down the pipe. Now let's get into 2024's base rate factor changes. So base rate is just that. It is the base rate. So carriers change their base rates every single year. It's based on inflation and overall performance on plans and carriers, and so you'll see these base rate factors change year after year. Most of the time they go up, sometimes they go down a little bit, just based on the market. So you can see this year Select Health went up 13%, U of U went up 10.5%, Molina went down 5.5%, Cigna seemed to just stay steady, and Regents went up 9.3%. This isn't really the entire picture because carriers have, take Select Health for example, they have 3 different networks and they also have 4 different meta levels. So if you want to drill down a little bit, you can see on the right hand side we break this down by network and by meta level. So the big changes this year, we're looking at Select Med in the bronze going up 25%. You can actually see the UHealth Plus network went down 3-4%. In the silver, they kind of stayed the same, but on their gold plans, they went down 5% as well. So you can kind of reference this and see how things actually changed by network and meta level. Now we're going to go into the area factor changes. So on top of base rate changes, we have area factor changes. So you can see here that in rating area 1, Select Health went up 8%, Molina went up 6%. You can also see Molina in rating area 3 and 4, it went down 2%. Select Health in rating area 5, which is Iron in Washington County, went up 12%. So if you have a client on a Med Network Bronze plan in Iron in Washington County, their plan just went up 37%, right? 25% from the previous slide on their base rate for bronze plans in Iron in Washington County, and their area factor increase as well. So there's going to be some significant changes. We're going to see benchmark plans increase quite a bit across the board. So this chart shows how the benchmark plan has increased by county. So you can see there are a ton of counties that have gone up 25%. An increase in the benchmark plan, which is the second lowest cost silver plan available in that county, means an increase in subsidy as well. So if the increase is high, subsidy went up as well. So this next chart is a rating area county chart. So you can see all the counties on the left, and then it will show the first, second, third, fourth cheapest silver plan available in that county all the way up through It'll show all the plans. So up at the top of the page, you can actually see the key. You can see Aetna is for A, B is for Bridgespan, C is for Cigna. So you can see in the top 11 northern counties, Aetna has the second, third cheapest silver plan available in all those counties. So, meaning that those plans, the second and below, first and second plans, will actually be eligible for a zero premium. So, keep in mind there's going to be a huge shakeup in the silver market this year. Aetna is going to become a real competitor. Let's jump into carrier changes for 2024. We'll go over Bridgespan really quickly. There's not much to report on. They will only be offering standard plans this year, so but no one will really be selling any Bridgespan. Molina, there is still no bronze plans. I think that's the plan for the foreseeable future. They have actually decreased premiums by 5.5% for 2024. As previous slides have shown, they're increasing area factors by 6% in cash and rich, but they're still incredibly competitive. I believe they have the first cheapest silver plan in Cache and Rich County. So Molina will be a force to be reckoned with in northern counties like Cache and Rich, and then down south in Iron and Washington counties. The University of Utah health plans, great health carrier health plan. We really love what they do. They have incredible customer service, incredible facilities. Prices are a little bit out of this world, but we can talk about the U Health Plus network that actually decreased by 3% in 2024, and they will be available through most of Salt Lake County, mainly because they've been able to add a few zip codes because they added a Holy Cross Hospital in that network. The only zip codes they will not be available in Salt Lake County will be the three listed here, which is Draper, Riverton, and I believe Harriman. So the Premier network has increased by 11% overall. That's a tough increase to swallow, especially after previous years of significant increases. Of note, all plans by the University of Utah Health Plans are 100% EHB, meaning that they are eligible for a zero premium if they are below the second cheapest silver plan in that county. Cigna, they are holding steady on rates like we've shown. They have added Primary Children's Hospital. I believe they did that last year, maybe in October, but they've had that through 2023 for the most part. I just want to note that they will have Primary Children's Hospital available in 2024. They will only be in Davis and Salt Lake counties. They're actually discontinuing plans in Weber and Utah counties for 2024. All of their plans are 100% EHB. They will be priced too high, so but some of their bronze plans will be eligible for zero premium. They have discontinued most enhanced diabetes plans and all of their asthma COPD plans in 2024. So there's only one bronze enhanced diabetes plan remaining. We believe this is just kind of due to a shift in carriers in general. We feel like carriers are starting to address the cost of insulin and chronic illness, prescription medications, stuff like that. So I think this will be a thing of the past, and it will be more standard across the board for all carriers. So they also have a new personal guide or a concierge service called their One Guide personal guide, and that phone number is listed here. All of the consumers that get a Cigna plan will have this number on the back of their card, and this concierge team will be able to help members find doctors in network. If they need a surgery, be able to lock down an ambulatory surgical center because they have a high deductible plan or whatnot. They're really just there to help consumers and make your life as a broker easier. So I think it's a great value add. Regents, they are discontinuing. There's a lot on Regents, so we're actually gonna have two slides, but We're going to go over a few of their plans that they've discontinued, like the bronze 8,000, the silver 5,500, and the gold 2,500. These plans weren't sold. There wasn't a lot of these that were sold, and then also with the reduction in plans that carriers are able to offer, it just made sense to get rid of a few. The Save Well network is still hanging on, so be aware of that. Their IFN network it stands for their Individual Family Network. It's a 4-state footprint, so that includes parts of Utah, parts of Idaho, parts of Washington, and all of Oregon. So you can go to any of those states and you can see a doctor just like you are in network. You just have to look up the physician and make sure they take the IFN network. Blue Card National, BCBS Global Care worldwide, urgent and emergent care across the country using that Blue Card National. Most of their plans are 100% EHB. Chiropractic care and IAP benefits, which stands for Individual Assistance Program, is available on their non-bronze, non-standard plans. So keep that in mind. Their optimum value medication list will be available. Which, they call their OVML, and that is deductible waived prescription medications for chronic illnesses. And so this is a great list that'll be available on Agent Intel and Regents.com as well. We want to highlight that if a brand name prescription medication is chosen when a generic is available, that the member will pay the difference. They can appeal this, step therapy, that kind of stuff, but just keep in mind that if a consumer just decides to go out on their own and start taking brand name drugs because they saw it on TV, it's not great to do for the health plan in general, but it costs a lot of money. So they're trying to combat that by saying, hey, if you'd like to take a brand name drug and a generic is available, then you'll pay that difference. We're not going to pay that difference. The IAP, Individual Assistance Program, this is their mental health program. Consumers get 4 free sessions, then an in-network copay per unrelated issue. So if there is an issue, they're able to get 4 free sessions. So they don't have to pay a copay, they don't have to do anything. It's free 100%. After they've used up 4 of their free sessions, then they will pay the in-network copay. If they have another issue that is completely unrelated, they get 4 more free sessions. This is available only on non-standard, non-EHB plans. Keep in mind. The accidental death benefit that was included in plans last year has been discontinued. There was only a few people that actually used that, so they felt like their money could be spent better elsewhere. Their new broker portal is here, which is great. They have really, really improved the broker experience with a new broker portal. This is where you can actually access your member data. You can pull ID cards. You can order ID cards. It's actually been great. So thank you, Regents, for doing that. Credentialing. This needs to be done by October 31st at midnight. So that's coming up. It's 26 questions. There's no time limit. Unlimited attempts. You have to get an 80% passing score. You need to make sure you spell your name correct, add your email address, and your Regents producer ID. You can actually access the credentialing right in your broker portal. So you go log into your Regents broker portal. It's right there at the top of the page to complete your credentialing. So make sure you go ahead and do that immediately. Select Health. They have rebranded, and so their colors are different. Also, the way that they have spelled their name is different, so it's now has a space in it. So you'll see Select Health spelled out like this now rather than one word. They discontinued their benchmark bronze 9100, their expanded bronze 5900, their silver 6500 diabetes support, and their benchmark silver zero copay plans. So quite a few changes for 2024, all based on that CMS rule limiting them to 4 plans per category. Not all plans are available on all networks. And once again, this is because of the CMS rule. They do have an off-exchange silver HSA plan. That plan decreased by 16% on the Signature and Value network, and decreased by 8% on the Med network, which is really good news for those that were on that off-exchange silver HSA. There is $0 generics for diabetes on all plans. So I think this is the reason why we're getting rid of the diabetes support plans in general, is because we're addressing them on all plans. The benchmark plans are 100% EHB, eligible for zero premium if they're lower than the second cheapest silver plan available in that county. Rating area increase in Iron and Washington counties at 12%, we covered earlier. They're the only carrier with a platinum plan, so they will actually be the only carrier with a standard platinum plan as well, because carriers are only mandated to offer a standard plan in the plans in which they offer the metal levels in which they offer plans. So if they don't offer bronze plans, they don't have to offer a standard bronze plan. But since Select Health offers a platinum plan, they have to offer a standard plan as well. Keep in mind that as of this moment, which is October, what's the date today? The 16th, October 16th, Select Health is still negotiating with Davis Hospital for their Value and Med network. So we are to, we believe that Value will not be in network with Davis Hospital, but Med more than likely will. But we will keep everyone posted, and we will post it on Agent Intel, and you'll be able to update your placement when that becomes available. We're going to jump into the new carriers for next year. Imperial, they're new for 2024. I don't think we're going to be seeing too much of this. Their plans are priced right in the middle of the pack. They're only in a couple counties, Salt Lake and Davis County, I believe. But they're not priced accordingly, and they're very, very new. So I think we'll take a stance of we'll wait and see to how they operate over this year. They've got approximately 100 members between two states, Texas and Arizona. They've also entered Nevada this year and Utah. So we'll wait to see on them. Aetna is also new for 2024. Everyone knows Aetna. They're part of the CVS family. They will be hotter than a jalapeno's armpit. So that's what we found they say in Georgia, along with other things that we cannot repeat. So we'll leave it at that. We have a 2-tiered network on non-standard plans. So this is something that's never been done before. Their network is the Peak Preference Network. This is actually a piggyback off of their large group network, and has been doing large group, level funded, small group in the state of Utah for a very, very long time. Very well known throughout the state to hospital systems, doctors, offices alike. Love them. So their Tier 1 network will include HCA hospital systems and Holy Cross hospital systems. So Tier 2 will include the University of Utah hospital system. And keep in mind, this is in the metro area. So when you're in a rural county like Iron, Washington, or out in Beaver, or up north in Logan, this network will also include IHC facilities. So keep in mind, the only difference between these two tiers are actually going to be copays and coinsurance. And we thought it would be a significant difference, but it's not. So if you have a chance to look at your placemat, you'll notice the difference in the Tier 1 and Tier 2 copays. They're not a significant difference. So keep that in mind. I feel like it's safe to say you can sell this as high consumer. You have HCA, Holy Cross, and University of Utah hospital systems in network.
And then if I can jump in for just a quick second. Yeah. So this is only... This tiered system only exists on their non-standard plans. So for the U of U standardized plan, there's not a tiered network system. It's just the network. So on the standard plan, it's the exact same copay for HCA as it is for Holy Cross, as it is for University of Utah. It's just all one network, only on the only on the Aetna standard plan. Sorry.
Yeah. So this is a little bit different, like I said, for this year, but it will be a tiered network, and it'll be a little, we'll see how it goes. We do want to highlight a few of their plans because they're incredible. And so if you look at the Silver 7 on the 94% cost sharing, you're looking at a $725 max out of pocket for that plan. That's versus Select Health's lowest max out of pocket on their CSRs, which is $3,000. So a huge difference in max out of pockets on those plans. Silver 6, CSR 87 and 94, they have 0 deductibles, which is really nice. Silver 5, the CSR 94 has 0 copays for PCP and specialist. So they all are kind of different, and you just have to determine which plan is best for your client. But they are all very similar in price. We're talking within $1 of each other. So price will be negligible, but the benefits will be different. So this will be a fun year to see how those plans roll out. I bet we're going to see the top 5 plans, that maybe 3 or 4 Aetna plans will be in there for 2024. We'll talk about some of their value adds. You get 20% off CVS Health branded products in CVS stores by using your Aetna ID card. So it actually has a magnetic strip on it, and you can use it at the CVS store to get 20% off CVS Health brand products. They have Minute Clinics nationwide. So these are located in, I think there are 6 clinics in the state of Utah, but they're all over the country as well. And so while traveling, you can actually go into any of these Minute Clinics. I think the average wait time was like 20 minutes, and it's actually a free visit. So they can do most things that a PCP can do, prescribe medications and whatnot. I believe they just can't prescribe narcotics. There is free 24/7 CVS Health virtual care on all plans, which is really nice. There's not a copay, it's free. There is a $100 per year allowance, and this is per policy, not per person. It's a quarterly allowance, actually. It's $25 per quarter for over-the-counter items at CVS stores nationwide. So you can go in and pick up NyQuil. You can't get NyQuil branded, but you can get the CVS Quill, and you can get that for free with your allowance. We also want to highlight that there are $1 copays for chiropractic care on all non-HSA plans, which is really nice. So there's no deductible that you have to meet. You can just pay a copay to go see a chiropractor. That's different for every plan. So can't tell you exactly what the copay. Real quick, we'll jump into Allstate and Best One Dental. These are our ancillary products for 2024. Allstate, formerly known as National General, same great plans, new name kind of thing. That actually has been a couple years, so it's still difficult though for people to transition. So we just want to lay that out there. They offer short-term plans, accident medical enhancers. Those are the 2 products that we sell the most of. There's new legislation aimed at decreasing the overall length of short-term medical plans, which is significant. So right now they're available for 3 years. So you can get a short-term plan for 3 years, which is not so short-term. But they are proposing that they have a length of no more than 3 months with an option to extend 1 month, limiting the maximum coverage period to 4 months.
And we got a lot of questions of whether that was local or federal. We just want to drive home. That is federal. So that will be short-term policies as we know it, coast to coast, may end up being limited to only 3 months at a time. And so this could be a very large change coast to coast for people that are on these quote-unquote short-term medical policies that run for a year or more.
And these have been great alternatives for people that are unsubsidized. But like David said, coast to coast, carrier to carrier, it's all the same. They're limiting those. The law has not yet passed, but we do expect it to, and we expect a change to be made here in 2024. And as soon as we know, you will know. And so we'll keep you up to date on agent intel.
But just mentally start preparing that you may have to talk to some of your short-term medical clients that are on these 1 to 3 year policies and let them know that, hey, we may need to reevaluate and see if you guys want to go this new short-term medical by 3-month route, or if you want to move yourself over to the ACA and pay the full unsubsidized price if you don't qualify for one for a bronze plan or an HSA or whatever they may end up choosing. But just know changes in the winds. As soon as it lands, we'll let you know.
Awesome. Best One Dental. Premiums have stayed the same. Benefits have stayed the same. There's no waiting period on these plans. There's no deductible. It has a $5,000 annual maximum option. It's like $95 for a family. It's a great plan, great product. We've had nothing but success with this product and this carrier. So if you're interested and you haven't been appointed yet, please contact us and we will make sure to help you with that. They have a vision discount plan embedded, and there's a direct broker link, so you're able to actually send this out to your clients, and it will get tied back to you as the broker. It's a very, very easy product to sell. It is one of those products, though, that you probably need to do at point of sale, just for success. We're going to run into marketing here. I'm going to turn the time over to David, and he's going to go over social media marketing for 2024.
Perfect. Thanks, Brandon. All right. Well, so yeah, there are quite a bit of changes going on heading into the year, and a couple of very important things that have changed overall about the healthcare space. And every year, Health First, we release a new line of marketing materials alongside our existing set of marketing materials that we've put together. But really our goal is to just try and set brokers up for success that want to grow with some specialized and customized marketing materials. So this particular year, there's kind of a heavy emphasis on neon. It seems to be the trendy style that is in. And then, of course, the heavy hitter for advertising space is social media. So we just wanted to highlight kind of the collection that we're putting together for this year and just showcase what you guys are going to get. So every year, as long as we have your name, phone number, and email, we will actually automatically generate these, and we will email these marketing kits to you with your information already placed on it. And then it's completely up to you whether or not you want to use it. So if you don't see this marketing kit before the last week of October, you'll just want to send us an email and say, hey, I never got my marketing kit. And we just need your phone, email, broker name, or entity name, and we'll send these out to you. And then same thing, if anything is misspelled or if you want a different phone number or a different email, just send us back and say, hey, thanks for the marketing kit. Can I get this changed? And we'll hustle you out a new set. So it's just a lot easier for us to mass generate these with everybody's information and then make corrections as opposed to trying to hunt down everybody's accurate current information that they want displayed and trying to get everybody's information synced up prior to running the generation. So just wanted to highlight a couple of things here. Specifically, the one here in the middle, we call this a referral driver. So we will have a couple of different versions of this. But this is specifically designed for you to give to a satisfied client for them to go post on their social media or to send to their friends or their family. But this is just a way to try and kickstart that grassroots marketing campaign. So if you're not already incentivizing your clients for leads, say with gift cards or whatnot, this is a good way that you can try and do that as well without necessarily financially incentivizing it, but giving them something that they can actually take and use to try and drive those referrals. We also do some that are holiday themed, so we're going to kick out the Halloween set first, but you'll actually receive a couple of kits this year. So you'll get kind of a starter kit, and then later on through open enrollment, you'll get the Thanksgiving kit, and then there will be a winter holiday kit as well. So just keep an eye out. You will get a few different sets with a few different themes, but all kind of in this simplified neon format. And then we also do a variety of sizes. So typically we have done flyers, postcards, social media, and then occasionally some yard signs. But I specifically wanted to showcase this set, specifically the one in the middle and the one on the right. So we talked a little bit earlier about the Medicaid unwinding and how that is going to continue through next year. So these are great ones that you can use at bus stops, DWS offices, just really anywhere that you might find people that are being kicked off of Medicaid due to the unwinding. There's still a very good marketing opportunity based on the Medicaid unwinding. So we would love for you guys to have that and be able to use them. And then the one on the right will have a couple of different variants of this that are really highlighting that family glitch and just saying that if your family is on an expensive group plan, you might qualify under the new healthcare rules. Come and talk to me. And so there's a good opportunity, actually a great opportunity there, because if you can find one family who their group plan is unaffordable, odds are there are other families that work at that company that it is also unaffordable for. So you may end up being able to scoop up a couple of different families that fail this affordability test that do qualify for a subsidized plan through the marketplace. And we want to be able to give you as many chances as possible to find those families. So keep an eye out. We will have one kit specific to losing Medicaid along with this kit that's geared towards the family glitch. So just be keeping an eye out for those. Next, we want to talk a little bit about Health Sherpa. So Health Sherpa has been absolutely amazing and phenomenal as far as enrollment platforms go. And so we just wanted to highlight, if you're not using Health Sherpa to process your enrollments, we highly recommend that you do. The platform is very simplified. The application is simplified. You can typically get through an entire application on Sherpa in a shorter amount of time than doing an application through healthcare.gov. They do have some backdoor access to healthcare.gov. There's actually a redirect that you can use so that you can access a typical healthcare.gov application through the Health Sherpa platform. And then you've got a lot of information coming your way on whether or not binder payments were made, on whether or not there were data matching issues, and if they've been resolved or not. It's just an extremely fantastic platform. We cannot recommend it any higher than we do. And then on the other end of this is, if your Health Sherpa is tied to Health First as your sort of upline in Health Sherpa, this gives us a lot of access to be able to help you troubleshoot applications and clients. So if you come to us for support and you say, hey, I don't know what's going on with this application, something seems to be off or something seems to be wrong, you can give us a call and we can actually pop in and look at that application and help you troubleshoot it on the fly. So from a support aspect, we really appreciate you being hooked up to our Health Sherpa so that we can offer you the support that you need when you need it to help fix applications and get things smoothly running again. We also get a lot of data access through Health Sherpa that we otherwise would not get from healthcare.gov. And so we'll show you this a little bit later, but in our proprietary broker portal, we have a section for your book of business. We call it the Bob, and we can get paid through dates. We can get subscriber ID numbers. We can get first name, last name, and just be able to bring in a lot of information from Health Sherpa alongside the information we get from carriers as your general agency, and we can bring those things together in Agent Intel in the Book of Business report. And so really it helps us help you more than anything else, and then it helps you as a broker just being able to have all of your clients in one spot, not having usernames and passwords, being able to check on data matching issues, being able to process applications quicker. There's virtually no downside to it. So actually, there is no downside to it. It's all upside. So to join Health First with your Health Sherpa, you can go into your settings and you'll want to use the Health First join code, which is 92 Bravo 9, as you can see on the slide here. But same thing, if you have any questions or concerns about it, just give us a call. We're more than happy to help you get it set up the way that you'd like it to be set up. So next, we're going to just talk about the green line. So the Health First green line is our broker support team. And we have extended hours that we operate throughout open enrollment. So we are going to be available Monday through Friday, 8 a.m. to 8 p.m. The local number for Utah is 801-889-1997. And keep in mind, you can call or text that number, either or, to get a hold of us. And then you can also email it directly at greenline@hfrocks.com. But if you have any questions, concerns, comments, support needs, reach out to us. We'll be available to help you out during that Monday through Friday, 8 a.m. to 8 p.m. Next, we're going to talk about Agent Intel. So Agent Intel is Health First's proprietary broker portal, and it is a incredibly ambitious and fantastic program. So within Agent Intel, we're going to do a demo, and I'm going to show you all of the different facets, but really quickly, we just want to sort of highlight what this is and why you would possibly want to use it. So Agent Intel houses our quoting software. It also houses our FAQs, which are pulled from varying sources across anything and everything to do with health insurance, in some cases Medicare, group insurance. It's just a large repository of FAQs about things within the health insurance world. You have access to your book of business, which means you don't have to log in and out of every single carrier portal, as long as it's information that we can get from Health Sherpa or information we can get from a carrier that you're appointed with us for. We can bring all of that client information safely and securely into your book of business in Agent Intel, so you don't have to jump from portal to portal to check on your clients. We also have a section for training. There's a lot of helpful walkthroughs, PDFs, videos. There's resources and fact sheets that we've created or we've pulled from carriers. If it was ever designed to be broker or client facing, we've pulled it in into one spot. And so there's medication lists and HSA waived medication lists, diabetic coverage lists. There's just a lot of really good documents and walkthroughs that are housed in there. There's also a great section for contact information. So if you're really tired of always trying to go to the web to hunt down this phone number or that email, same thing, we've done all that and we've brought it all into one spot and just made it easy for you to find that information. But we'll jump in and do a demo and kind of show you what's available through Agent Intel. All right, brokers, welcome back. We are going to do a quick orientation and tour of the Health First proprietary broker portal, which we call Agent Intel. So you'll need to go to agent-intel.com and you will go ahead and sign in with a Google account. And this is how you'll be able to access the system. If you are currently on our broker list, you should be able to log in straight away. If not, just keep an eye out for some emails from Health First regarding your Agent Intel registration, and we'll make sure that we get you set up and we get you access to the system. Once you're logged in, you'll land here on the home page. Health First and Agent Intel, we utilize this banner notification system just for any sort of need-to-know information. Once you click on the X over here on this side, it'll disappear and you'll never see it again. Really, we just use this for any sort of breaking news items or any need-to-know information that we want to convey to brokers without doing an email blast or doing a text blast. You'll typically find those here in Agent Intel. And then the portal actually consists of these 9 tiles, or these 9 main tiles, and they have various subsections. We're going to go into QuoteMeal is our proprietary quoting software, which we'll do a deep dive into in a minute. But you just click on it here, and then you'll log in one more time with your same Google account, and we'll get you up and running and quoting. Here we have the coverage search option. So the way that this works is when your client gives you that laundry list of providers and medications and facilities, you can come here to the coverage search. You can enter those in. You can actually save them to this little coverage cart up here, and then have a PDF built out that just shows where those providers are covered by carrier, by network, as well as what tier of coverage their medications fall into. So, for instance, if they come to me and say, hey, I see Benjamin Smith Haymond, I can go ahead and find his name. I can see here at a glance where he is covered or not covered. I can go ahead and save that to my coverage cart. I can scroll back up and I can say, okay, let's go look at some prescription medications. And let's just look up atorvastatin. And we'll do 20 milligrams. So you can look it up by name, dose, form. There's even the RxCUI number so that you can get very specific and make sure that you're pulling the right medication. Here, it'll tell me which carrier and what it's covered as. So each carrier is a little bit different. You can see here Molina for 2023 covered it as preventive, and then Select Health covered it as a specialty medication. U of U covered it as a preferred generic. And so you could just kind of tell which carrier is probably going to offer the best coverage. The closer it is to being preventative, the better, or being generic, the better the coverage will be. But so we could just add all those things together. It comes here together in the coverage cart, and I can save this as a PDF for my records in the client file. But just filling out that laundry list and seeing who covers their providers and who covers their medications to what degree. So all of that's hooked up in the coverage search, and this pulls from the CMS or the healthcare.gov data set, and it also cross-references with the carrier's data sets as well. So it's pretty darn accurate, and it updates all the time as the carriers or as CMS updates it. So pretty fantastic stuff there. Here we have the book of business. I'm not going to be able to show you too much of this because I actually do have clients of my own in here. But you can filter by plan, metal level, and by carrier. And really, this is where, as your general agency, we have a lot of data access either through the carrier or if we're your upline on Health Sherpa, we bring in as much of your client data as possible from those two sources, and we bring it together here in the book of business. So that way you don't have to, oh, let me log into Health Sherpa, but let me go log into this carrier portal and see if I can figure out what's going on. As long as we are added as your Health Sherpa upline, and as long as we are your general agency with the carrier, we'll be able to bring all that data into one spot. Let me see if I can at least try to blur some of this out, and I'll pull up a client and at least just kind of show you some of the fields that are available. And so you'll be able to see contact information, phone numbers, date of birth, whether or not they applied for the policy, last four of their social, their address, their plan, their cost sharing reduction, the effective date, paid through dates, as much information as we can get as possible, either from the carrier or from Health Sherpa. We're going to bring that information in to your book of business so that you can access all of that in one spot without having to jump around from source to source. So, fantastic stuff there. Reports, this is going to be all of your commissions data. So here we have a data set hooked up. We've got policies, commissions, and lives right now over a 13-month period, and you can just kind of see your rise and fall. You can drill down and look at your specific policies or look at your specific carrier commissions. You can toggle individual and group if you happen to do group business, and just anything and everything relating to your commissions over time as they come through us as your GA and get to you. You're going to have access to that along with commission reconciliation reports and pay stubs, things of that nature. So anything and everything related to commissions, you'll have access to through Agent Intel. The FAQ here is a ongoing project. We are constantly pulling in FAQs from various sources and adding FAQs of our own. This is consolidation of good FAQs, the most relevant FAQs from healthcare.gov, from CMS, from the IRS, from insurance carriers, from Health Sherpa, from Best One Dental, from Allstate, and then from the things that we've dealt with by running our support line for brokers over these many years. So this is a good place to turn to find a quick answer for a lot of different things is our FAQs. The resources and fact sheets section is really anything that was created by a carrier that was either meant to be broker facing or consumer facing. And there's a lot of different things in here. So agent of record forms are in here. If the carrier offers any sort of co-branded marketing, we try to bring that in so that you can have access to it. Summary of benefits we try to bring in. And then fact sheets would be things like the list of medications that have the deductible waived on an HSA plan, the Regents Optimum Value Medication list, the Cigna diabetic coverage fact sheet, any of those things, we try to bring them all in here, and you can cruise them by carrier specific. You can also just search Agent Intel for what you're looking for, and it'll go through the different sections and just see if there's any hits on your search terms. Library and training is going to be anything that you can use for yourself to either grow as a broker or to train support staff in various areas of the industry. So there's a lot of the knowledge base is going to be your PDF walkthroughs, in-depth articles on how subsidies are made, what an essential health benefit percentage is. It's all in here. So scholarly articles and how-to walkthroughs. And then training is going to be video repository, just lots of stuff. Videos we've made about how to do things in Health Sherpa, things that General Agent Center has made regarding their Best One Dental products, other videos with Best One Dental, our past Education Day videos, our current Education Day videos that just get people up to speed about what's going on in the Utah marketplace, trainings that we've done with Health Sherpa, that Ross Baker was kind enough to do for us, videos about Allstate. There's just a lot of great visual guides in the library and training section for brokers to grow or brokers to train support staff. We are currently working on the contracting section. Eventually, this will show you at a glance which carrier contracts you have assigned under Health First. It will show what carrier contracts are available through Health First, and then you'll be able to request and track contracting through this section as well. So every carrier is vastly different in their contracting process. And so this will just kind of keep you in the loop on, hey, you've done your part, we're working on our part, the carrier's working on their part, so that you're always kind of in the know on what's going on with contracting. Lastly, we have the important contacts section, and this is really just a spot that we house all of the relevant phone numbers and the email addresses for all of the carriers that we work with. There's nothing more annoying than sifting through, web pages and documents trying to find the appropriate contact information. We're going to go ahead and do all of that and bring it all here in one spot, so that you can really just say, okay, I need this carrier, I need this department, and here you go. Here's the number, here's the email that you need. So that is our proprietary broker portal agent intel in a nutshell. And then stay tuned as we drop in and we'll do a deep dive about the QuoteMeal quoting platform. Thank you so much. The next big thing that we want to talk about is QuoteMeal, which is Health First's proprietary quoting software, which now features eSign. So within QuoteMeal, you can quote on-exchange and off-exchange medical plans. You can accurately quote them with a subsidy. As of right now, the rates for Utah are locked in. This means that you can go ahead and set up QuoteMeal and you can go ahead and start quoting today for January 1st effective dates. So you can get a little bit of a jump on open enrollment by starting quoting today. Here you can also add in accident coverage, you can add in dental, you can add in vision, you can actually look at short-term medical policies as well, all in a spiffy quoting side-by-side environment. There's a section, it also operates as a CRM. You can store your client's PII that's necessary to run applications. And then the big one that we've added now is eSign. So eSign is specific for your clients that you need to gather consent and application attestation forms for. Now you can just send them the documents. They can e-sign it on their end, and the system will capture that document and that e-signature, and it'll go ahead and store it on our servers for 10 years, and then it will send you a copy as well. So we've made it very simple and straightforward for you to be able to quote your clients and to gather these forms and meet all of the requirements that you need for consent and application attestation. So once again, we'll dive in and do a quick demo and just kind of show you where all of that is. All right, brokers, welcome back. We are going to be doing a deep dive and an orientation of the QuoteMeal quoting platform. So this is Health First proprietary quoting software, and I love this thing. It's amazing. Let's talk about why. So I don't know what everybody is doing for quoting, and we just want you to know that this exists, that this is a free option to you as a broker that works with Health First, and here is everything that it does for you. So, first and foremost, it is a quoting platform. So within the platform, you can do on and off exchange major medical policies. You can do short-term policies. You can bundle together these policies with accident coverage through Allstate. You can put on the riders for cancer, heart, and stroke, or the sickness hospital indemnity policy as well. You can do dental through Best One Dental, and then you can do vision through Opticare. So, a lot of cool stuff. You can do subsidies accurately for on exchange subsidies, cost sharing reductions. All of that is up and accurate. As a very quick note, right now, as of right now, on October 17th, rates in Utah have been finalized. What this means is that the software is updated. You can go ahead and start quoting January 1st policies effective today. It is up and ready to go. You can go ahead and start quoting. You can go ahead and start getting people lined up for open enrollment. You can hit the ground running on November 1st and just start doing applications because you've already had some time to go ahead and start running quotes and getting people set up for 2024. So fantastic stuff there. Always nice to get a little bit of a jump on open enrollment. So combination quoting along with CRM. So there is a section that I'm going to show you where you can store your client's PII safely and securely that you'll need to be able to submit applications, whether that's on exchange, off exchange, accident, dental, vision, whatever it is. There's a spot you can store that information so that you can recall it, so that you can submit applications. There's also some quick access links for prescription drug formularies to double check coverage, provider searches, summary of benefits, and then you can also send out, so this is our newest edition that we're pretty stoked about, is eSign. So eSign is another project, proprietary, built by Health First from the ground up. And it's a way that you can send a consent form and an application attestation form to your client from the quoting software. All they have to do is open the email and then click to sign. So they don't even have to draw with their finger. They just click to sign, and it captures the date that they signed, the IP address that they signed it, the name of the person that signed it, and then stores that on our servers for 10 years. So it's up and running, ready to go, fully compliant. It's fantastic and so simple. So just truly robust and fantastic software. I'm done talking about it. Let's go ahead and show you all how it works. And I'm sorry if it got a little bit loud there. I shifted in my chair a little bit closer to the microphone. So here on the left-hand side, you can go ahead and gather your client's contact information. And this would be the primary contact for the household. Really, this is just a way for you to be able to capture your client's contact information in case you need to get back to them for any reason. So once we go ahead and put in a zip code, it's going to go ahead and extrapolate the state and the county, and it's going to go ahead and start pulling a list of all plans that are available. Right now, the effective date is set to January 1st, 2024, so it is going to go ahead and pull 2024 rates and plans. So you'll see Imperial and Aetna mixed in there. If you are quoting an SEP, you could just drop it back to November 1st, 2023, and that'll go ahead and pull the 2023 carrier and rates. But let's go ahead and do January 1st because open enrollment is almost here, and I'm super excited about it. So here, you're going to start gathering the members' information that need to be on the policy or are part of the household, and then we'll talk a little bit about these icon sets. So a birthday is always better than a date of birth. It's just going to give a more accurate representation for quoting, and it's also going to be important that they have a date of birth for the consent and the attestation form. So in a pinch, if you're running a quote, you can go ahead and just use an age to at least get kind of a bearing on what it's going to cost them for the policy But once you get down to it, you're going to want dates of birth for accuracy and application information. All right, so now that I have gone and added the client's date of birth, it's going to go ahead and tell me, okay, for these ages in this county, these are the unsubsidized prices for these various health plans. And then just as a quick show, you can just go ahead and toggle this short-term option. You can set the term duration from this drop-down, and this will go ahead and mix in the all-state policies along with these major medical plans. So if you want to quote, say, a short-term policy with all of the riders versus the lowest cost bronze plan for somebody that's unsubsidized, you have the option to do that. Let's go ahead and toggle short-term back off. And then let's go ahead and look at these policies. So real quick, we're going to talk about the icon sets and the options here underneath of the members. So you can select gender. This has no bearing on ACA policies. This stuff is all just short-term medical. So short-term medical does rate based on gender, and they do have some discounts if you had prior coverage or if you meet the preferred pricing with the limited underwriting questions. Those are just housed underneath these arrows for each member of the household. You have this icon set here where you can toggle whether or not this member needs to be included on the policy. So if you run into a household where the employee doesn't qualify because their group plan is affordable, but the family does, you can come and you can toggle off the employee and just have the rest of the family members on the policy. Here you can toggle whether or not they are included in the tax household. And so this would be if you have a child in your household, typically from a divorce where you are not allowed to claim them as dependent, but you need to provide them with health insurance. This is where you would say, in that scenario, this person is not a part of my tax household, but I do want them on my policy, and it'll calculate the subsidy based on that information. This one's just for whether or not they need to be included in an accident policy and whether or not they're a tobacco user. Not every carrier rates up for tobacco use, but this will be built in where you can say, hey, this member is a tobacco user, and it'll go ahead and calculate the tobacco rates based on the carrier's rate up. So now that we've got that, let's go ahead and apply for some tax credits and cost sharing reductions. So of course they need to know how many people are in the tax filing household size and then what their income is. So right now we're just going to go ahead and plug in they're a family of two making $40K. And this will populate the blue chart and the green charts here. And this will tell you what percentage of the federal poverty line they fall at, how much of a tax credit they're going to qualify for, what sort of cost sharing reduction they're going to qualify for. And then it will also tell you, this is a handy bit of information, is the family unaffordable premium amount. So we talked previously about the family glitch fix and how family coverage through a group policy can be deemed unaffordable to the point where that family can come to the marketplace and qualify for a subsidy. And so this is the math. So you can say, based on this person's income, this is how much their group plan would need to cost for it to be affordable or unaffordable. So if you change their income, it's just going to change the math. And it says, okay, this is their monthly. If it's over this much per month, it's unaffordable. If it's under this much per month, it is affordable. And then you can click through these different scenarios. You can add some custom federal poverty lines. I have done that just to illustrate the breakpoints here for the cost sharing reduction. So you can see here is the cap to qualify for the 94% cost share. And then at 150%, now they're in that 87% cost share, goes all the way up to 199% is the cap for 87. And then once they're in that 200%, they qualify for the 73% CSR, goes all the way up to 249%. still in the 73. Once you hit 250, now you're in that standard 70% cost sharing reduction. And if you were paying attention, you should have seen the deductible and the max out of pocket here changing based on those cost sharing reductions. And so, yeah, cool stuff there. So once we have all of the household information and the tax credit information, let's just go ahead and pick some policies. I'm just going to pick 3 of them at random. And as you hit these check marks, it will add them to the quote. Here on the quote mini tab, you can kind of view these in a side-by-side environment, which I prefer to do instead of trying to scroll endlessly up and down through this section. Is I just find the ones that I like, I check mark them. You can actually check mark several of them, and they'll all end up here on this quote side by side with a breakdown of the out-of-pocket costs, the visit costs, prescription drug costs, and then this premium amount section will come in a little bit handier once we start bundling policies. Right now, all of these policies are free just because the subsidy is eclipsing the cost of the plan. Let's bump up their income so that there's a little bit of variety there for the pricing. And then oh no, they're all still free. Let's try and bump that up even a little bit more. Okay. All right, let's give that a shot. There we go. So now we can see a little bit of variety in pricing. So, and then let's just say that there is one policy that I want to draw the client's attention to over the others. Just mark it here with a heart, come back to the quote. This will just show you, for disclosure's sake, I want to show you all of these plans that are available. However, based on our conversation, I feel like this is the plan that best fits your family's needs. That's why I marked it with a heart, is just, if I was going to get a plan in your situation, that's the one that I would recommend the most. Here on this quote section, real quick, you can download this as a PDF for your records. And then you can actually, once you've emailed a quote to a client and you have saved them to your quoting software, you'll be able to come down to this drop down and be able to load any previous quotes that you had sent the client. So just letting you know that there is a running history of the quotes that you have sent to your clients as well. And this is where that information would be stored. So real quick, let's go ahead and let's just chuck in, let's just say it's a family. They're going to get all of the accident medical enhancer, the sickness rider, the cancer heart stroke rider. They want to get some dental for the family. Let's throw in some vision for the family, and let's see how that looks on their quote. So now you can see the quote has grown. So now there is a section for the medical enhancer, there's a section for dental, section for vision, and then there's a breakdown of the policy's premiums at the bottom. So you can see here, this was the original unsubsidized price for the health plan. Here is your price plan after subsidy has been applied. And then here are your various costs to add the medical enhancer, to add the dental, to add the vision. So fantastic stuff there, super easy and slick to do. And then let's say that the client is satisfied, they want to get that package. Let's go ahead and start getting an application done. So this is the newest feature that we've added that I'm super excited about. So anytime you start to generate a client, you'll go ahead and get this consent and attestation form section to populate. I would recommend go ahead and save the client so that they are in your quoting system and you can pull this back up anytime you want. So the first thing you'll want to do, and let's talk about these and make a distinction. So a consent form is really just establishing the role between client and broker. It is similar to an agent of record form, but it's not the agent of record form. This is just saying, hey, this is my broker. I want to work with this person. And then you have that for your records for healthcare.gov or whoever else to say, yes, I do have a signed consent form from this client. They said they wanted me to be their broker and work on their health insurance. So the consent form you only need to gather once, and it remains in effect until it is rescinded by the client. That is one of the stipulations that is actually in it. And so here I do have some missing data just because I have my quote email is the same as my send email. But here, most of you will get this business entity and quoting phone. You just need to type in your company name and then your quoting phone number. And just save those to the system, and then you'll be able to send that on its merry way. Let's just change this real quick. And then I'll be able to show you what these look like. So send that on its merry way. So your client in their email will get an email that looks like this with the consent form. They'll be able to click on it. They'll be able to click on review and sign. And then they will be able to scroll through these pages or just click go to signature, jump to the bottom. They will go ahead and click on submit. This will go ahead and send a copy to yourself. It'll go ahead and save it on our servers for 10 years. And then when you come back to the quoting software, it'll actually update, and I may just have to do a refresh here. Let's try that. And now it shows as being complete. So consent form is done, easy peasy, out of the way. Now I can go ahead and gather your household information that I'm going to need to be able to submit an application. So here in the High tab, you can go ahead and gather home address, socials, notes about the household, income sources, anything and everything that you would need to be able to submit an application. And safely and securely store that and save it to your client. And then once you've gathered all that information, it's time to go ahead and move to running an application, preferably through Health Sherpa, because we love them to death and their software is amazing. But you'll want to grab an attestation form. Now, the consent form you only need to get once, remains in effect until it's rescinded. An attestation form you need to gather every single time you touch a customer's application. If it's going to generate a new eligibility notice, you need to get an attestation form. You can click on the attestation form, send it on its merry little way. Okay. So that will open the application attestation form. It will go over the client's information, the broker's information, and just go over the questionnaire that occurs at the end of a Health Sherpa or a marketplace application. And they'll just say, yes, that is, I swear everything that I have told my broker is true. Sign and submit. Perfect. And now we can see that I have a consent form. I have an attestation form. I can now move on to Health Sherpa and I can go ahead and enroll this client. So the last thing that I want to touch on real quick is that in Agent Intel, we do have various sections for summary of benefits, provider search, and prescription drug coverage. The tool actually has some of these links as well. So you can click on the network. This will jump you to the carrier's provider search. You can click on the plan name. This will launch to the summary of benefits. You can click on the RX deductible, and this will launch you to the formulary. And then the client will actually have some of those links as well on their quote that they can go look up that information themselves. So that is Quote Meal in a nutshell. Don't forget to hit that confetti button. Treat yourself to a little confetti show every now and then. Thank you so much for watching, and have a lovely day. Lastly, once again, I just wanted to highlight the Health First Green Line, our broker support team, and just I'm so excited for this open enrollment, despite the fact that there are a lot of big and crazy changes that are coming. I am extremely excited for it, and I'm excited to hear from brokers, and I'm excited to be able to help solve problems on the fly. And that is the whole reason that we do what we do, is because we love brokers, and we love health insurance, and we love helping clients and helping brokers. And so just a reminder, we do have this support number, and this is a very wide, varied support number. So this is anything and everything to do with health insurance, anything and everything to do with healthcare.gov, anything and everything to do with filing taxes and the IRS and how that affects health insurance, and troubleshooting applications through Health Sherpa. There's really not a wrong question here. If you have a question, reach out to us. We would love to help you. We would love to be there for you. So you can call or text us at 801-889-1997. You can email us at greenline@hfrocks. And our extended hours during open enrollment are going to be 8 a.m. to 8 p.m. Monday through Friday. So please reach out to us. We'd love to be a resource for you. Thank you so much for watching. Hopefully you have a lot of questions answered. If you do have any questions, please run out to the Green Line and text us, call us, email us. We'd love to chat with you. But thank you so much for watching. Have an incredible year, and we look forward to seeing you all next year. Wow.